Welcome everyone. We are in conversation with Dr. Avinash Kavi, who is Professor of Community Medicine in Jawaharlal Nehru Medical College, Belgaum. So, has taken up numerous researches and is going to give us information about COVID vaccination and what we need to do and what we need to know about it. Thank you, sir, for taking out your time in your demanding schedule. I'm sure this is going to be an insightful session for most of us, and we are going to learn something new from this. Thank you, sir. So we'll start with the first question. So what is the idea behind mass vaccination, and how much of the population do you think should be vaccinated to achieve herd immunity?
Good morning. Regarding the vaccination, whatever we have started already, the government of India has initiated a mass vaccination strategy on January 16th of this year. And initially when we started, it was prioritized to the healthcare workers, for the healthcare workers, including the doctors, nurses, all the people who are working. It was extended to the subsequently, so it was extended to the frontline workers, including the revenue and the police department and so many other people. And from March 1st, it was started to the general public. That also we started in a phase-wise manner. First, we started for elderly above 60 years and above 45 years to 60 years with comorbidities, and later on to above 45 years. And then subsequently, recently, we started with 18 years and above. So this is how the mass vaccination strategy, what it shows is who are at highest risk of getting contracted with the infection. If wherever the immunity, those are the people who have to be protected. Has been designed in India. It is one of the best model that we can observe across the other countries where they have started the vaccination. So whenever we want to protect our people, we something called as herd immunity. That is what is the immunity which is prevalent in the community that can prevent the onset of the infection, which can prevent the epidemics. So minimum we want to cover more than 60%. When the 60% of the population gets immune to all these different type of the virus, though then only the herd immunity is generated. That was very well established in mass polio vaccination strategy, which we started as pulse polio program in the year 1995. So the same model, what we want to achieve here is 60%. But there is a difference between what we are seeing in the pulse polio and here. Pulse polio, there were very well defined 3 types of virus, and we started, we got all the information, we knew everything about that virus. So we know how to go about it. But here the problem with all these SARS coronavirus is it is changing its structures day by day. And as we can see the difference in the presentation, different in the mortality rates, the morbidity rates over 2 waves. So that is how we need to be prepared. And of course, though in spite of all these difficulties, our scientists have come up with very good vaccinations which are even effective against the new strains as well. So that is what is the funda of this herd immunity, and that whereby we can achieve that particular epidemics and achieve the control over the epidemics, and so that we can prevent the further onset of any more further waves.
Yes. So what are the major problems that we've been facing during this administration of the vaccine that has been going on?
Basically, when we started this vaccination, take these vaccines because of the concerns of the safety. Because though we know that a lot of research has been done, clinical trials were on the way, but the results were not published. That is one thing. And a lot of negative propaganda also took place. See, this can be expected in a country like India, for catering for the population of 140 crores and counting. So there are different cultural setup, different regions, and people's, the education level, the knowledge level, everything differs. So there were a lot of negative propaganda about this vaccine, sometimes politically motivated, sometimes unscientifically propagated. So those were some of the roadblocks, and that is why when we started the mass vaccination, always, this is not only with the COVID vaccine, this is true with any vaccine, any new thing which comes to the market, people will initially reject, they will not accept it. Then once people start taking, when they feel it is their felt need, and that is what we are observing after the second wave came. When we wanted to give it in January, February, people were reluctant. And now what we are seeing in the month of April and May, people are standing in queues waiting for hours or days together to get the vaccine, but vaccine is not available because of the shortage. Of course, vaccine cannot be developed overnight. So that is what is the major roadblocks. Of course, if we go on listing everybody individual, there most of them are subjective in nature. So I don't think we can discuss each and every point of that. However, there are a lot of myths associated with the vaccine, and the scientific community they came up with a very apt information, especially the ministry and the ICMR. They gave frequently answered questions and suitable answers for that, and by which now that it is coming down, this whatever the stigma or the myths associated with vaccines are just coming down.
Okay, so can you please describe the cold chain in brief and the role that it plays as the vaccine delivery system in our country?
See, basically, cold chain is a system where we maintain a temperature of whatever the required temperature for that particular biologicals from that place it is manufactured and it is delivered to the beneficiaries. So what we expect is sometimes in the walk-in, so there are various stages. So once the vaccine is produced, so every vaccine there is, we can see a sticker on it called as a vaccine vial monitor. So this vaccine vial monitor measures a cumulative exposure of the temperature, because if the temperature crosses more than 8 degrees centigrade anytime, and there are evidences which say that for a particular vaccine, for these many hours it should be maintained in 2 to 8 degrees centigrade. For some majority of the hours it should be maintained less than 2 degrees, and some of the vaccine can be freeze, some of them if they freeze they get deactivated. So it depends on the type of vaccine. Of course, when we are discussing about the COVID vaccine here, COVID vaccine, every vaccine has its own shelf life, what we call it as, and these shelf lives have to be maintained, and that is what is the system of cold chain. So it will be manufactured in whatever Serum Institute or Bharat Biotech or whatever. So from there it will be sent to the walk-in cold rooms, and from there it is transported at 2 to 8 degrees centigrade to the state, and from state it is distributed to the district walk-in cold rooms, and from district walk-in cold rooms it will be distributed to all the primary health centers or the private hospitals, and it will be stored there in ice-lined refrigerator. And on the day of vaccination, whenever we take out that particular vial, when we open that vial, see, we have to document the temperature and document the timing of opening of the vial, because what we have observed, once we open that vial, we cannot use it after 4 hours. That is very important. That has to be, whatever the side effects are, whatever being observed. See, there are two types. One is adverse event following immunization because of the biological, or because it is done with an improper technique. Either the way we give the vaccine differs, or if the storage was the problem, and when we have crossed that 4 hours and then we have administered the vaccine. And when we are vaccinating in a huge scale, these are bound to happen. So at every primary health center, at every point of delivery, that has to be maintained. So this system, from the time it is manufactured till it reaches the beneficiary, it should be maintained within that specified temperature. And that is what is the cold chain system is being functional. And this is not a new thing for India. Cold chain system is very well established across all the remotest of the setup, because every primary health centers we are equipped with ice-lined refrigerator. Of course, the power is a big problem. The power supply, continuous power supply. Most of the primary health centers are equipped with generators and some with deep freezers too, so that we can maintain the temperature. But however, recently what has happened is every Iceland refrigerator in a primary health center, there is a direct link which will be monitored at the taluka level and the district level. So if there is excursions of the temperature above 8 degrees, or if the temperature drops below 2 degrees, there is an alarm setup which has been established recently. And that will
Okay,
tell
sir.
us the overall efficacy of the vaccine too. So that is how, when this system is in place, so there was no problem in distribution of the vaccine so that it reaches the beneficiary in the specified temperature.
Thank you, sir, for letting us know that. But, sir, are there any additional steps that you think the government should take up in the current strategy that is being followed?
Okay. In the current strategy, whatever we are following, it was very apt, which I've already explained, how it was given to the most needed people
Yes,
to the less needed. However, in the any pandemic or any of these waves, there is nothing called as more needed or less needed. Everybody needs the vaccine. But
definitely.
we have, even then government took a major step and prioritized people who received the vaccine. That was a wonderfully designed model of delivering the vaccine. Apart from that, at rural areas, whenever we are thinking of vaccinating, see, there are two things. One is people are not coming uh, and getting the vaccine. Second is those who are coming, they are not getting the vaccine because of the shortage of the supply. And there are some hurdles like registration in the COVID app and other things. So for
Yes, sir.
three things, we need to give an answer for that. So for the people who are reluctant to come to vaccine, other day in I think 2 days back, there was uh, the news in the Times of India in Gadag district. So one of our postgraduate alumni is in charge medical officer of that area. In spite of convincing in that particular village, they said it seems that a saint who is there, who is protecting them from COVID disease, and because of that they are reluctant to take the vaccine. This is one issue. And recently in just 8 kilometers, not even 8, I think 4 kilometers away from Belagavi city, called as one of the village, so there are totally 140 of the COVID infections which were reported, out of which there were 80 deaths. And that became a big news in the media. And again, why these deaths are occurring is because of the ignorance regarding the disease, as well as the same can be applied to the vaccines. So that ignorance has to be minimized by proper information, education and communication activities at the PHC level, at the subcenter level, at the village level. So this cannot be done only by the health workers or the doctors. It has to be,
Definitely.
there should be a community engagement where we will take into confidence of the religious leaders, the village heads, the panchayat people, or people who can influence the decision making of the people. So if we incorporate all of them together and then give this message, so definitely we can overcome this hurdle. This is one thing. Second one is people who are coming and they are not getting the vaccine because of shortage of supply. For that, we need to ensure that there is a continuous supply of vaccine. What is happening is, because suddenly when there was the manufacturing is going on, definitely crores and crores of doses are manufactured. But when it reaches a particular village, see, there is a system how we indent the vaccine, so how we deliver the vaccine. So now the indenting system was given to the state governments, and now recently when our prime minister addressed the nation, he told that 75% of the vaccines, it will be procured from the center and will be distributed to the respective states as per the population. So that ensures there is a continuous supply of vaccine that should be ensured both at the central level, state level, district level, as well as the taluka level. So that is by the administrative process. Then the third one is regarding the hurdles that people are experiencing because of this registration in the portal. So most of the people are inaccessible to this internet facilities, though they might
Yes, sir.
have smartphone, but internet facility is a big challenge in especially in the remote rural areas. So for those people, there is an option for walk-in registration, where the registration can be done at the primary health center and they can receive the vaccine. Why there is all this negative propaganda which is being showcased in the media is because there is sudden increase in the demand, and once this demand is catered for another 1 or 2 months, subsequently it will become a part of routine immunization. So then there will not be any major roadblocks. So I think these are the three things we need to take care of at present.
Thank you so for shedding light on this. So, according to you, how is vaccine wastage a factor, and how is it affecting the efficiency of the program?
See, vaccine wastage initially, there is something called as open vial policy. Open vial policy was not applicable to majority of the vaccines before. In the year 2013, when Government of India introduced pentavalent vaccine, and it was given free of cost, where the 5 biologicals were there in the DPT, hepatitis B, and H influenza, Haemophilus influenza. So when these three, all 5 were given at a cost where the country can afford it, and to make people acceptable, and so much of money was being spent, so Government of India thought we should bring open vial policy here. Open vial policy is, once we open the vial, that has to be given whatever the people were there, but whatever was the remaining doses of vaccine can be stored, provided if we maintain the cold chain system in a proper way.
Yes.
But unfortunately, even this open vial policy was even applicable in the pulse polio program also. Unfortunately, for all the present COVID vaccination, open vial policy is not applicable because of the instability of the currently available strains. So that is what that is the mandatory mentioning of the temperature is important on the vial. So once we open the vial, we cannot use it beyond 4 hours. And initially, what they told was that where we are given it, where we had planned to giving it to the prioritized people like healthcare worker. So there, even if 1 or 2 persons come, we have to open the vial and give them the vaccine, because they had the appointment scheduled on that particular day. But subsequently, what happened was there was lot of vaccine wastage which we observed in the month of January, February. Then subsequently in the March, whenever the Government of India revised the strategy of this vaccine policy, they specified that until unless 10 people come and register, we cannot open the vial, so that there should not be any major vaccine wastage. So because of so many doses got wasted because of that, only because the open vial policy is not applicable. Subsequently, once there is improvement in the where we can take care of this also, in future we may get vaccines where open policy may be applicable, but I don't think that will happen in the near future. So until unless that there is a scope for vaccine wastage, and we have to take care of that in it is an administrative decision by not vaccinating until the 10 people come. So if we take care of that, there will not be much wastage. That is what we have observed.
So with respect to stability, like you had mentioned, is there any specific vaccine which is more preferred for remote or rural areas where we might have, some curbs regarding the storage?
See, presently, if we are talking about Indian setup, see, already 2 vaccines we are already using, Covaxin and Covishield. Both have the similar temperature regulation requirements, that is 2 to 8 degrees.
Yes.
So that is also applicable to all the other vaccines which we are currently using under the universal immunization schedule. So there is no problem with regard to which particular vaccine is efficacious in the rural setup. So both Covaxin and Covishield are equally efficacious, and it can be given in the rural setup. The third one which has been introduced is the Sputnik. Sputnik vaccine had a stringent storage requirements. But recently, when Dr. Reddy's lab have got the permission to manufacture the vaccine, they have taken measures so that even Sputnik vaccine is also is eligible to be maintained and to be given, because they can store it for more than 2 hours. That is what the literature says. More than 2 hours in 2 to 8 degrees centigrade. Even that can be given in the rural areas also. But presently, whatever is there, Covaxin, Covishield, I think those are sufficient to be given in the rural areas and to curb the infection in that.
For however long this has been going on, what are the adverse effects that you have seen in patients following immunization?
See, adverse effect, whatever are reported, are very mild in nature, like the local swelling, induration, or even induration is also very minimal. Locals like pain is more common. Fever, chills is more common. Sometimes because of apprehension. Initially, what we saw, because of that vaccine apprehension, people got breathlessness, their blood pressure went high, and all those things were observed. But most common is the fever and pain at local site, and which subsides with the paracetamol or even cetirizine and other things, and it will not be prolonged for more than 2 days maximum. 2 days
Hmm.
was maximum, but even most of the
Yes.
people got okay by even one day. That is, and whatever the serious adverse effect which we are talking and we are interested in, like so many whatever we are being observed. So if we just look at the rates of serious adverse event, that is 1 per 1 lakh, or 11 per, to be specific, 11 per million. That is when we see in younger age group, that is at around 25 years age group, the serious adverse effects is 11 per million, that is 1 per 1 lakh. That is what the serious adverse event rate. At same time, when we look into the elder age group who received the vaccine, the adverse event rate came down significantly, where it was 4 per million.
Okay.
So, 4 serious adverse event for 10 lakh people who received the vaccine. So, you can just imagine the safety profile of those vaccines, and the deaths occurring because of not getting vaccination, again that is 23 per million in younger age group, whereas it is 800 per million in elder age group, those who have not received the vaccine and have died. And especially in the second wave, we have lost many lives because of this particular infection. And especially when we look into the clinical profile of the people who have died, it is very clear that people who have not received vaccination, who had received the first dose just 1 or 2 weeks prior to their getting infection, those are the people who have died. Otherwise, in majority of the setup, unless they don't have any major comorbidities, hardly very less number of people, hardly few people whom we can count in fingers. So only those many people have succumbed to this particular infection. Otherwise, people who have received at least a single dose of vaccine with efficient increase in their antibody level, they have not been affected with any serious kind of illness.
So, in your experience, based on the current speed of vaccination, how long do you think it will take to control and eventually eliminate the virus altogether?
The elimination of the virus, presently we cannot assure anything. Even if I assure, that would be a very wrong message which I'll be giving.
Yes, sir.
So probably this virus is going to remain with us. It will become an endemic and it will remain with us. So we have to start to live with it. We have to make up our life, make adequate lifestyle modifications so that we can survive along with this virus. So that is what we can tell at this moment. And at the current rate of vaccination, Government of India is claiming that it will vaccinate whoever above adult population, that is more than 18 years, by end of December. That is what they claim. However, because of lot of new vaccines are also coming up, they may achieve that. But at the present rate, whichever we are seeing, this has never happened before in India. By from June, I think from January 16 to June, what we are seeing in this last 5 months, we have nearly vaccinated 23 to 24 crores of population. And this shows how well our healthcare delivery system is being strengthened in our country. At the same time, there were a lot of loopholes, there were a lot of mistakes at various levels. We should not, but that happens in any country. See, one thing, please, all of us should remember: no country in this world, including the best of the economies, what we talk about, or high income countries, none of the countries are ever prepared for any pandemic. We should always keep that in mind. So pandemic is nothing which occurs suddenly, and which is we cannot assure that we should increase the bed to so many that after 1 or 2 months, what will you do for with those beds? Only thing is proper triage system, proper information education to the people when they should come to the hospital. So this has to go, and once they come to a particular hospital, what treatment is being for, evidence-based treatment they receive, everything needs to be monitored, and that is where we need to be very sure about it. So I cannot clearly tell, because there are lack of evidence, like how well we will be able to eliminate and how well we will be able to achieve that vaccine and infection control. Probably it is not only about the vaccine. We have to follow other preventive measures like social distancing, use of mask, and proper hand washing techniques and sanitization procedures. Then only we can really take control over or any pandemics which is present, or in future also we may get many of those kind of diseases.
Okay. So the next question is that could you please tell us the difference between effective reproduction number in vaccinated people and compared to the unvaccinated population?
So presently, that research is going on. What we have got in one few papers, what we just when we go back and look into the literature, what we can say is, if at all a person has got any vaccination, any kind of vaccination, and received 2 doses, as what the literature says, he or she can eliminate nearly 70% of the infection. Now, what does it mean? If we vaccinate 100 people, among them 70 persons will be able to eliminate that particular vaccination for example, 70 people among 100, if they get vaccinated, 70 people at least can control that infection. So when we look at the efficacy of the vaccine, see, efficacy is what we measure not only at the time of clinical trials, that has to be measured. It's an ongoing process. Efficacy, if at all, even if we consider efficacy of 50%, say, okay, if I give this vaccine to 100 people, at least 50% will see to it that they don't contract the infection. That is what is efficacy. If we take it as 50%, so number needed to avert one infection would be 2 persons, 2.4. The number is 2.4. That is 2.4 persons in mass. There cannot be 2.4 persons. 2.4 is the number to avert one infection, and number needed to avert one serious disease is 25 odd. 25. If 25 people are vaccinated, so we can eliminate one serious disease, and 33 persons, if they get vaccinated, we can eliminate one critical disease, and to avert one death, 65 people have to get vaccinated. So presently these are the numbers we can give some information about that. But effective reproduction rate, presently I'm unable to tell because of lack of evidence. Maybe in near future we may get that number as well.
Right, sir. So what is the strategy behind extending the time period between the 2 doses?
Basically, once whenever the vaccine trial started in the last year, the duration between 2 doses was 4 weeks. That is what was tested.
Yes, sir.
Subsequently, what happens is, whenever we ask a person to come at 4 weeks, most of people they turn, but some people, because of some problems, they may come up 5th week, 6th week, 7th week, because the number who participated in this vaccine trial are huge in number, more than 28,000 to 30,000 people. So when people came late, that is after 6 weeks, after 8 weeks, after 12 weeks, or later than that, so there was a subgroup analysis of these people. How did they eliminate the infection? When there was subgroup analysis, they compared versus 4 weeks to 6 weeks, 6 weeks to 12 weeks, and they found that more if we delay the vaccine, second dose of vaccine by another 4 weeks or another 6 weeks, the chances of that immunity is high. And what in the last wave, in the first wave, whenever we declared anybody as cured, when RT-PCR negative and he was discharged from the hospital, what evidence said that was, at least those antibodies persisted for at least 3 months. That means the person was immune at least for 3 months. So after 3 months, there is a theoretical chance of getting that infection again. So generally, what has been observed is these vaccine antibodies, they generally wane off after 12 weeks. So
Okay.
at the time of waning off that of antibodies, if we give a second shot, that is as a booster dose, so there are chances that it may prolong for at least an year or so. That is what is the present understanding. The research is on to see whether a booster dose is required.
Okay.
So probably we may come up with the booster dose in near future. The research is on. We may get an answer in a few months together. A lot of research is going on. A lot of literature is being published. And
Hmm.
once most of the people have predicted that there will be a booster dose. We don't know when. It may be after 1 year or after 14 months or 18 months. We don't know. But there will be a booster dose. And don't think that COVID vaccine is only unique, that it is not giving protection after 1 year. This is applicable to most of the pneumococcal vaccine. Even typhoid vaccine, you have to take it every 2 years. So
Hmm.
it is not like none of the vaccine give lifelong immunity unless and until like rubella or some other kind of vaccines.
Yes.
Otherwise, all the vaccines, there will be a requirement of booster dose. Even for rabies vaccine, we
Hmm.
give booster dose. And after some years, again we have to take, if we get bitten by a dog, again we have to repeat that schedule. So it is applicable to all the biologicals, especially these vaccines, and none of them give lifelong immunity. So we have to understand that reality and go further and see how best we can eliminate with what level of booster doses and to whom. And we may get an answer in by this year end about that, and so slowly they may come up with a booster dose.
Okay. So, do you think that there's a requirement of modifying the present vaccines that are being used according to the new mutant strains that are coming up?
Presently, whatever vaccines are available with us, the Covishield or the Covaxin, they
Yes.
claim that they are also effective against some of the mutant strain. See,
Okay.
this is very much true that these kind of viruses like SARS-CoV virus, we saw the SARS epidemic in the year 2002, and now after 18 years, we are seeing SARS-CoV.
Hmm.
And because of the changing climate scenario or different our changes in the lifestyle, we may come across newer strains of vaccines in near future. We may get entirely a new virus. As we
Yes.
have this novel coronavirus, there may be something new. And till then, that is called as, there is a complete newer virus. Till then, lot of antigenic shift keeps on occurring with this type of virus, because it changes its structures, so that we are having that different strain of B116 and so many other strains, UK strain, South African strain, Indian strain, all those things.
Hmm.
So whenever the vaccines are being developed, they anticipate, because we have understood these viruses over a period of decades together. A lot of research has been done. They
Hmm.
anticipate that these are the possible mutation it can undergo, and they also take care of that. But
Hmm.
sometimes if there is antigenic shift, antigenic drifts occur very frequently, where if
Yes.
there is a complete shift in the antigen structure, again
Hmm.
some of the vaccines may become ineffective. But presently we are not in that scenario.
Yes, sir.
There are research evidence saying that it is effective against these vaccines as well. So we'll see what best can be done in near future once we come across different mutant strain. And definitely there will be a modification in this particular vaccine production, so that it will take care of that mutant strain as well.
So, what is the importance of the asymptomatic or the subclinical cases that you are seeing nowadays?
The subclinical cases, because again the the chances of developing the infection and the chances of developing the symptoms depends on the individual immunity level. So once the immunity level is low, the symptoms will be more, the chances of transmission of the virus will be more. But the asymptomatic cases definitely are there before also, now also it will be there, and future also it will be there. So these people will be at risk not only they will realize it later, and they may land up in a problem with severe disease. That is one problem for the individual who is having asymptomatic disease. Otherwise, the people who got infected from these asymptomatic cases also are at risk. So that is why we are advising, even if you have received vaccine, even if you have see to it that you take all precautions, you have to wear mask for long term process, at least for at least next 1 to 2 years, so that we can effectively win over this particular pandemic situation.
So, can there be any other public health measures that can be taken up by vaccinated and unvaccinated people to curb the infection?
There are only 3 public health measures. One is definitely apart from vaccination. Vaccination is the strategy where we can definitely take care of when we have ready-made antibodies with us to prevent to fight against the when the virus enters the body. That is the most ideal situation. But till then, or even after that, because until that herd immunity develops, we have to see to it that we follow SMS, that is social distancing. If mask has to be used properly. Wearing the mask is also very important. People wear mask just to showcase and to just get escape from the police. They just wear mask wherever they want, but that is not the way. Properly cover, it should be covering the half of the face, the nose and mouth especially. That proper wearing of the mask, and the social distancing, of course, in a country like India, where the density of the population in overall density of the population is more than 400 per square kilometer, and that density increases in the metropolitan cities to 1000 to 1500 per square kilometer. Social distancing may not be applicable everywhere, but in these cases, if we avoid social gathering, mass gathering, religious gatherings, so that is very important. And overcrowding in the public transports has to be avoided. That is one thing. Then mask and sanitization. Sanitization, not we should not keep on using the sanitizer every time. Soap and water is the best thing. Whenever soap and water is not available, sanitizer has to be used. But there are a lot of myths associated with the spread of this virus, lot of myths associated with the vaccine. Those has to be taken care, and that has to proper knowledge has to be given to the people at different levels. Then only we can definitely take care of this particular infection.
Okay, sir. So thank you so much for this conversation. I'm sure this will be very useful for a lot of us, those who are not aware, or those of us who have been lacking some knowledge. I'm sure this will be very informative. Thank you, sir.
Yeah, thank you so much. But most of the questions were related to public health perspective. I'm very happy that students have come up with this novel idea of spreading the message in a different way. And also, most of the questions related to the policy and the public health perspective will definitely it will create more awareness among the learned people, because education will not give knowledge most of the times. We cannot say that all educated people are knowledgeable enough. So we have to create awareness. That awareness should come within, and only we can spread awareness to others. And in that way, this particular conversation and the questions which were asked were all very much relevant to the current scenario and the current pandemic control. So I congratulate all the organizers and the student community for having thought of this novel idea. And I wish they come up with many more novel ideas, with more and more interaction with the faculty members, so that we spread the correct message to most of the people. Thank you very much.
Thank you, sir.